Donald Trump's list of leaders to take over the country's health agencies is nearly complete and hardly conventional. Take, for example, this newly resurfaced podcast interview with Robert F. Kennedy Jr.
I would probably today be diagnosed as ADHD. I was bouncing off the walls. I couldn't sit still. In school, I was non-compass mentis. I had no idea what was happening, and I was at the bottom of my class. I started doing heroin. I went to the top of my class. Suddenly, I could sit still, and I could read, and I could concentrate. I was probably at some level medicating myself, but it worked for me, and if it still worked, I'd still be doing it, but it didn't work.
Okay, so to recap, the prominent anti-vaxxer who may soon lead the Department of Health and Human Services says heroin helped him become a better student. In that same interview, Kennedy goes on to suggest that antidepressants are some of the potential culprits behind the rise of mass shootings. He claimed, quote, "It can't be just the guns." Just a couple of years after a global pandemic killed millions across the globe, Kennedy wants to suspend the funding of infectious disease research by the National Institutes of Health. Yesterday, Trump picked just the right person to help make that happen as leader of the NIH, Dr. Jay Bhattacharya, a non-practicing Stanford physician who has called for overhauling the agency. Dr. Bhattacharya was vocal about his anti-lockdown stance during the pandemic. He co-authored the Great Barrington Declaration, which suggested that young people should be allowed to spread the coronavirus freely at the height of COVID in order to reach herd immunity. Dr. Anthony Fauci dismissed the declaration as, quote, total nonsense. Joining me now is Cheryl Gay Stolberg, New York Times Washington correspondent covering health policy. Good to see you. What has been the medical community's response to Dr. Bhattacharya's nomination?
Sheer terror, I think. They're in a panic, especially infectious disease experts are very, very nervous about all of Trump's picks, not only Dr. Bhattacharya, but also, of course, Robert F. Kennedy and Dave Weldon, the former congressman who Trump has picked to run the CDC. They're all on a slate of, a polite way of putting it would be unorthodox.
So when you say that
candidates.
that specifically infectious disease doctors are concerned, what is it that they're concerned about?
Well, as you already mentioned, Robert F. Kennedy Jr. has said he wants to slash the research budget for infectious disease. He says we're going to let infectious disease take a rest for the next 8 years. Experts know that, a pandemic could happen at any time. We've got a bird flu outbreak in cattle and in poultry, and that is very worrisome. If bird flu were to jump from human to human, it would be far deadlier than COVID. They're worried about Jay Bhattacharya at NIH. He stood during the pandemic in opposition to standard public health measures like masking and social distancing and school closures. And experts who are more in the mainstream say that those measures saved a lot of lives and that if we have another pandemic, they are very worried about how this Trump team will respond.
Just to illustrate the extent to which he stood in opposition to some of those methods and messages, he was one of the authors of the Great Barrington Declaration. Can you tell us just a little bit more about that, how it was received?
So the Great Barrington Declaration was a gathering of epidemiologists and others who issued this manifesto, this treatise in 2020, saying basically that we should let COVID spread unchecked throughout the population among young people and people who are healthy while protecting the vulnerable. And they called this focused protection. And it was dismissed as fringe and, in fact, dangerous. Tony Fauci, as you said, called it utter nonsense. Francis Collins, who is a former director of the NIH himself, said that it was Bhattacharya was a fringe epidemiologist. And I think we have to understand kind of where Bhattacharya is coming from. He is a medical economist. So he's not thinking in a public health frame of let's save as many lives as possible or let's stop the spread of the disease at all costs. He's thinking about balancing the economy and other factors against public health imperatives.
Well, to that point, Charlotte, as you all know, a lot of these picks come down to managing budgets and making decisions about how money is spent. RFK Jr. has said he wants to move NIH funding away from infectious disease research. What does your reporting tell you about whether or not that would be possible with a Dr. Bhattacharya leading the NIH?
Well, certainly the HHS secretary, if Robert F. Kennedy is confirmed, has wide latitude over the budgets of the agencies, the underling agencies, if you will. NIH reports to the HHS secretary. So it is certainly possible that funding would be cut. There's no question about that.
I only have about a minute left, Cheryl, but I do want to ask you, we have new reporting tonight from NBC News. Let me just read you a little bit of that. RFK Jr. has likened vaccination to sexual abuse by the Catholic Church and claimed that the CDC is a cesspool of corruption filled with profiteers harming children in a way he also likened to Nazi death camps. When you have talked to medical professionals, what is their concern about vaccination specifically as it relates to America's young population?
Well, we're worried. Vaccination is dropping among children. More and more parents are opting out of vaccinating their kids. We're seeing measles outbreaks now. And the concern is that if someone like RFK gets confirmed, he will be urging states to drop their childhood vaccine mandates. These mandates have been the foundation of the greatest public health triumph in history, which is the elimination of some very, very deadly diseases like polio and measles and mumps. So there's obviously great concern about RFK Jr.'s views on vaccination. Now, how much he'll be able to achieve, government is it's like a big battleship. It's hard to turn around. But clearly, the president-elect wants to shake things up with these nominees.
Cheryl Gay Stolberg, thank you so much for your time, for your expertise.